Good afternoon, this is Emmanuel Irizarry Martinez from Homeless in Harrisonburg, Virginia. Today I would like to talk about a topic that is not often talked about, but it is necessary to discuss it. The topic is elders and homelessness. According to the National Coalition for the Homeless, studies across the U.S. have shown a clear upward trend in the proportion of older persons aged 50 to 64 among the homeless population. This is a group which frequently falls between the crack of governmental safety nets. They're not old enough to qualify for Medicare. However, when their physical health is assaulted by poor nutrition and severe living conditions, they may eventually resemble someone much older. There is a relatively low percentage of elders aged 65 and over homeless persons among the current homeless populations. This smaller proportion may be due to the increased availability of successful safety net programs, which only kick in at a certain age, including subsidized housing, which is available at age 62, Medicare, which is available at age 65, Social Security benefits, which are available at age 65. Now, why is this an issue? Unhoused older adults face some serious challenges to their well-being relative to younger adults. Homeless persons between ages 50 and 62 often have similar health care needs to housed persons 10 to 20 years older. Studies show that older homeless adults have higher rates of geriatric syndromes, including problems performing daily activities, walking, vision, and hearing, as well as falls and frailty compared to the general population. Older homeless people are also more likely to suffer from cognitive impairments compared to younger adults. Older homeless are likely to suffer from impairments resulting from depression or dementia, which can contribute to the worsening of their physical health. Isolation also contributes to homelessness among other persons. In a 2004 survey, half of the recipients of supplemental security income that were 50 years and older had been living alone before losing their homes. Now let's talk about gaps in benefits. Many older homeless persons are entitled to Social Security benefits. However, these benefits often fail to cover the cost of housing. In 2010, the monthly SSI payment for an individual was $703, well below the poverty line. Research based on that figure shows that generally a person receiving SSI support cannot afford housing. A person receiving SSI support will have to pay 112% of that income to rent a one-bedroom apartment or 99% for a studio efficiency apartment. The SSI payment is not only intended to pay for housing, but to supplement the cost of other basic needs. If SSI represented an individual's entire income and the average cost of other essentials were subtracted, then $181 would be an affordable renting price for housing. Now let's talk about the lack of affordable housing. Increased homelessness among elderly people is largely a result of poverty and declining availability of affordable housing. There are at least 9 seniors waiting for every one occupied unit of affordable elderly housing nationwide. Furthermore, the waiting list for affordable senior housing is often 3 to 5 years. Now, how can I advocate on behalf of older and elder homeless adults? Greater recognition of the elder homelessness issue is needed. Federal, state, and local authorities, as well as nonprofit service providers, have to be made aware of the specific needs and challenges faced by older adults and elderly persons who are homeless. For instance, older homeless adults are best served by professionals who understand geriatric healthcare principles and who are sensitive to the fears and concerns of older individuals. Expanding a range of targeted populations eligible for supportive services to include much older homeless persons under the age of 65 will help bridge the gap and benefit accessibility. Invest in permanent supportive housing. The National Leader Initiative to End Elder Homeless reported that developing supportive housing represents the first step towards stabilization of physical and mental health. For older and elderly homeless persons without supportive housing, health care is likely to be received intermittently in emergency rooms and other crisis-oriented healthcare facilities, which is more expensive and results in fragmented care. If you would like to read more about this, I will put a list of documents. You can look for it in the description. Thank you and have a good afternoon. This was Emmanuel Irizarry for Homeless in Harrisonburg, Virginia. Goodbye.